This brief video is about your background outline that you're completing as a group. It's worth 12 points. There may be different people in the group that get different scores. For example, if one person barely does any work and everybody else does a lot of work, the scores will be different. But this way, everybody works on one document together and submits it. One person in your group is going to submit 3 documents, and the 3 documents will be the reference list in APA format, your outline, and then a peer review. Each of you will do a peer review of everyone in your group to give the instructor an idea of what happened in the group or if someone in the group did not do their job. It's important that you do not do other people's jobs once tasks are assigned. The reference list, everyone else in the group will only submit one document, and that is the peer review. Everything is submitted in Blackboard, and the only people who see the peer reviews are the instructors. Your reference list should have somewhere between 3 and 20 references. More is not better. You might be able to write the whole outline with 3 references. It just depends on what you're using. One of the most important factors here is that to get the most current data, you probably will be using web pages. Not everything you need is going to come from a textbook or a peer-reviewed article. So make sure you have the kind of references you need to do this outline. One of the unique things about these outlines is because all of you have different topics, the headings in the outline are different. There's some examples here we're going to talk about, but there's 5 groups. Not all 5 of you are going to have the same things in your outline. And so if you are to ask, what are the headings? The answer is we don't know because you all have different topics. The level of your outline should be the kind of work you would do at a 400 level class for a paper, but it's not everything in this outline may be presented to the students in your health fair. This is an example of what it should look like. You should have each of the numbers with what the topic is and who's doing it. You should have number 1 and number 2 should be there. Everything else is going to be different. So this is describe the community demographics, give data to show the needs and assets in the community. Those are required. Then the rest of these are all examples that may or may not fit. Signs and symptoms of the disease, telephonitis, common myths, epidemiology, pathology, prevention, treatment, management. Again, they're going to vary. The first 2, number 1 and 2, must be in there. If you notice, next to each topic, it says who's responsible for that section. So ideally, you will meet as a group and develop the headings, divide the headings, and then before you submit it, put it all back together to make sure it makes sense. An appropriate way to use AI would be to create your outline headings and submit it to AI and ask it, if it were to create an outline for your topic, would they change anything in the outline? That would be an appropriate way to use AI for this assignment. Not appropriate to ask AI to do your outline. All right. We already covered that. This is the recommendations, and I've already talked a little bit about this. Make your headings, assign the headings to different people, create a shared document with the headings so that people can put their stuff in. You'll have a reference list. People could put their references right in there. And inside the outline, you should have in-text citations. Have a check-in date to see if anything needs to be added or changed. Of course, that's going to be before the day it's due. Have a date where everyone posts everything they have. That should be several days. It may not be 5 days, but it should be several days before it's due. Review and meet to discuss what might need to change. That should occur within a couple days of when it's due. Complete and revise and prepare to submit. what's really important when you divide topics up in an outline is that when it gets submitted, it doesn't look like 5 different people did the outline. It looks like it was all done by one person. So you might want to have someone go in and check the formatting to make sure it looks like that. There's a sample at the end of the document. It's an average sample. It's not an A, it's a C plus, because there's not enough details in it. But your outline must include in-text citations in the reference list. Okay. This explains how people might get different grades, and here's the scoring rubric. 4 points related to directions and APA, 12 points related to content, spelling, and grammar. So this is the way it's going to be scored, and we're going to next look at the sample to see what it looks like. So this is a C plus, B minus outline. It is above average, but it doesn't have enough, the in-text citations are not accurate, and there are not enough details, because when the instructor reads this, they should know what you know. If the instructor can't tell what you know, then we don't know if it's accurate or not. So you can look at this on your own, but some some examples. This is for 5th graders. So remember, 5th grade content would be different than high school content. If it were on HIV, we might talk about body fluids. We might talk about vaginal fluid or sperm or semen. We definitely would talk about blood. Then person to object. How do surgeons and nurses possibly get it? Maybe talk about needle sticks, and maybe talk about high risk positions in healthcare, and appropriate disposal of healthcare material and trash. There's some examples of, here's the first case, possible transmission. The main issue with these details, are that the details are not specific enough that the instructor can tell what the person's writing. This is just meant to show you some examples. This is not going to be graded, that it's an exact outline format. What's important is that it's divided into sections that make sense and that it's there. An outline is not a paper. There should not be paragraphs. There should not be narrative. There should be statements that show what you know and what you might share with the audience. You do have to have spelling and grammar correct in it, but it may not be full sentences. It may be phrases. Okay. I would recommend you look at this and then ask questions if you have any. This is your background outline scoring tool. It will be updated because you don't have a partner's name. You'll be your name and your group name, and each person in your group will fill it out. And notice, here's a sample right here. For example, how to do a needs assessment correctly. I'm doing it, and I think I did A minus work because I did need a few revisions, but I did meet deadlines. Then here is Susie Q. She was supposed to explain how we conducted our needs assessment. I think there was an effort, but it was not a high level effort, and therefore I gave her a C. You must give grades, and everybody cannot have the same grade. And you must give comments as to how you came up with that idea. These are examples that are not related to this paper. What is related to this paper is APA formatting, spelling and grammar, all the topics, and if you need more rows, feel free to post them. If somebody's responsible for the final proofing, if somebody's who's responsible to submit. So you will do this for everyone in your group, but it will be on one page, because who's responsible for this will be listed in the center, and scores that you would give them will be listed in the right. Again, if you have questions, just make sure you ask.